little things which they are asked to follow. So thank you so much again for the presentation. With that, I would just one more note for the participants, that if you have any questions, we'll be taking questions at the end. So please feel free to drop any questions you might have in the Q&A section if you're watching it from the conference hall, or in the YouTube chat section if you're watching it on YouTube, and we'll address them towards the end. With that, I would love to hand it over to Dr. Dilip, and who will be talking about healthcare workforce.
Thank you, Molly. Thank you, MSAI, for getting us on this platform. And Anuj, you actually made my life much simpler. I can just focus on a small segment now that you've given the whole panorama of things that we do. And I would have loved to see the young students on screen as well, because I mean, that keeps us going, right? And also, I would like to keep it short. Would like to hear from you and try and address your questions as well, because we are jumping from one online platform to the other for the last year and a half, and thankfully it's a Friday evening, and we'll have no more for the weekend. All right, let me quickly share my screen and all right. If we don't talk about some of the work that we do or we advocate for in the COVID-19 pandemic, then the discourse during these days would not be complete. So I've termed this presentation as Health Workforce COVID-19 and Beyond. And at some point in some section of the presentation, I will also quickly touch upon as a public health career, what are some of the options which are available for young medical students as well. I hope you like what you're going to hear in the next 10-15 minutes. During the pandemic, because you might build hospitals, increase beds, get oxygen concentrators, ventilators, but all that has got no meaning if you do not take care of the health workforce component or the surge capacity, as we love to speak in the technical lingo. But to put it simply, I'll try and break it down into simpler segments during the next few slides. The first and foremost, and look, WHO India has got a very large presence all across the country, in all the states, and a big team at the center. So through the team in the center, as well as through our network, there are thousands of us in the field, in every state, every capital, most districts. So we try to work towards this, document, advocate, so on and so forth. The first and foremost is how to look after the health workforce that we already have within us at a very difficult time, when it's just not about risk to the infection, but also about the psychosocial part. So these are some of the protocols that are internationally accepted, and also the government advocates for the central government. And as we said, even at the subnational level, we're trying to advocate that such practices are followed. Roughly, the testing, the PPE kits, the quarantine, the safe return if they're infected, how to reassign tasks, how to ensure reasonable working hours and longer breaks, how to rotate between low and high stress duty stations, and the mental and psychosocial support. There's a different section on this. Say, for example, through their insurance coverage, by increasing it, or at least getting it in place, putting it in place. The other is how do we add to the numbers that we already have? So most of it are with the governance to do, but more funds, more positions, but some of the part that might be relevant to you. And now the government has also acted, in the recent times on how and why we should deploy final year medical or nursing students during COVID-19 pandemic. Not necessarily to man the ICUs or take care of critically ill patients, but when the regular workforce is diverted towards COVID care, how these students can fill in for other regular, less serious or routine patients. And it also includes other streams of healthcare providers such as physiotherapists, psychosocial stream students, retired health workers who can do non-COVID duties as well. The last one is where you might have a role to play even in the coming months. Hopefully we won't have a third wave, but who knows? So how volunteers, students at the first or second year students, third year students can even volunteer for non-medical support activities, how to maintain data. Each one of you can contribute in some small way or the other when the country is facing these huge problems because of the COVID-19. The complementary measures to decrease load on the health facilities, thereby decreasing unnecessary pressure on the health workers themselves. So telemedicine, mobile clinics, outreach services, using more of community health workers to respond to non-serious ailments or regular ailments like treatment of fever, diarrhea, so on. And how can we improve the first responders or the first level of caregivers, such as the family members, the community members? These are some of the areas that is being considered, is being worked on in many states, but India's huge country, so no state or no district is at equal footing. So somewhere or the other, they are at different stages of consideration or implementation. Now, the administration, how can they help? How can they support financial incentives, sick leaves which are paid? And these are all not just for permanent, but for the temporary or the contractual workers as well. And one of the things that the councils should consider, and some state governments are working towards it, are these temporary licensing measures, especially for those passing out, or say people who have studied medicine from abroad, but still to clear their qualification exam. They might be given a conditional license for 3 months, for example, or 4 months, till such time they can practice. They're qualified doctors in their own, where they studied, but with the caveat that this is the period, and within that you need to clear your exams if you need a permanent license. So such are the measures that can be considered during these days. Now, let's get back to also some of the work which in the international arena with WHO and the World Health Assembly is also taken cognizance of, and that is showing commitment and also using these platforms to advocate for more support and also the importance of healthcare workers. 2020, because I don't know how many of you still remember, it was the 200th birth anniversary of Florence Nightingale. And 2020 was declared as the year of nurse and midwife. There were a lot of activities planned, but then COVID came. But still, the whole year was used to highlight what kind of challenges the nurses and midwives face. And more importantly, advocate for more investment in the nursing and midwifery workforce. Similarly, which Anuj had mentioned there as well, 2021 is the International Year of Health and Care Workers. So here we're also talking about the social workers, social care providers, not just medical doctors or nurses, and how we can improve. And the key here and very aptly so at this point in time, is to how to improve the protection of healthcare workforce, how to improve the working conditions, and also how we can further strengthen the training for health and care workers. So we still have more than half the year left. And this was also the theme for the World Health Day. So, I mean, that's how the larger discourse in the globally is taking place, and not just in India. All right. Now, the heart of the matter, a career in public health. I hope after this 1 hour of interaction that we have had with you, if we are able to even get a handful of you young, bright minds to come work in public health, that would be very nice. Me and Anuj, when we were there in the medical college, that was decades back, uh, public health community medicine was not that lucrative, and Anuj will agree with me. But as the years have passed on, and as public health becomes more and more important in our day-to-day life for good health, wellness, and preventive measures, the interest is caught on. So what are the conventionals? I put it this way. So you have the MD in community medicine, or they call it MD in preventive and social medicine. 3 years post your internship, or nowadays you even have to do these compulsory rural services before, after which only you are eligible to appear in these entrance exams. And a 2 year, the second one is a 2 year course, which is a usual duration for a master's in public health. And there are about 70, 80 or some more institutions in India which provides these 2 year courses in masters in public health. And if you even want to go further, you have PhD in public health or a doctor in public health. Well, that's a much longer program. If you have that much patience and insistence, these are the options that you can do. But on the other hand, in the recent years, you have post-MBBS compulsory postings in the rural areas. During my time, before we entered the medical school, we had to sign a bond with the government that we will come back and serve 5 years in the rural areas of my state. I don't know where that is right now, but used to be there. And also good examples like the Christian Medical College, Vellore. Even during the MBBS time and post-MBBS time, they posted doctors in rural areas. And they have a large network of about 200 or some more rural hospitals or health facilities run by their churches. So that's where they go. And I've seen many of them, my friends, and I've met so many of them, very inspiring stories, who have actually gone back to serve the same tribal, rural, poor population, vulnerable ones, once they complete their courses or complete their post-graduation. All right, these are some of the other career options that's available. I mean, I can share this slide later with Smalley. Won't go into detail. So many of them: biostatistics, nutrition, epidemiology, global health. It's endless. This is just it's not limited to this list. There are far more than what is shown here. In terms of if you want to make a beginning with the UN as youngsters, 20, 22-year-old kids, let me give you 2 quick snapshots. One is the WHO internship program, and we call it for future leaders in public health. Now, these are available at different levels at the country, at the regional, and maybe at the HQ, Geneva. WHO has a system called STELLIS. I think if you really want to go into this, you must remember this. STELLIS. That's the only way you can officially apply for any positions in the WHO, be it internship or higher positions. And the other one with the UN is the UN Volunteers Program, it doesn't not just health. It's about peace, development, human rights, So if you want to diversify further, these are some of the other options. Let me just quickly, just give me a moment, Molly. I'm almost done. Um,
No problem, sir.
yeah, just yeah, I'm just give me. All right, so this is the WHO website. The links are given there, how you can apply, what are the objectives, and most importantly for you, what are the do's, don'ts, whatever. And there is also a section on frequently asked questions. Trust me, I've never done this in my life, so I'm not aware of all these FAQs, but for you to just click and check it out. And the other, of course, is this link which I've given there for the UN volunteer program, how you can become one, what are the current opportunities, and so forth. So, okay, can you see my, okay, just all right. So, yeah, that's all that I have to say. But to me, health workforce is a very dear subject, which I've worked for many years now, for more than a decade, dedicatedly, and I feel that at the heart of providing good health care is a happy health workforce. Skills, trainings, leave that aside, but I think this is the crux. And my last message to the youngsters is that there is no way to understanding public health, whichever stream that you may take, health workforce or anything else. There is no shortcut. Let me repeat: there is no shortcut other than getting your hands dirty, starting from the bottom, and then trying to go up the ladder. And my email ID is with Smalley. If you still feel that you need more inspiration, I would be more than willing to touch base with any one of you and then guide you more. Thank you so much. Thank you. Yeah, over to you, Molly. Thank you.
Thank you so much, sir. And I think I can say with some confidence that these were topics which were something our members have been interested and have been wanting to learn more of. Considering the last slide which you had was one of the most important messages which we or which all of us can take, that a happy about a happy health workforce. And it comes into it fits very nicely with the theme which we have for the International Year of the Health and Care Worker, which is protect, invest, and together. And I hope that with this is one of the steps towards advocating in terms of supporting uh, all our health and care workforces and giving them more power to work towards bringing a change. So thank you so much again for that presentation, sir.
Thank you, Molly. And just for your information, that photograph was had taken this way back in 2005. I was visiting a rural center in Karnataka, and this has stayed with me for what now 15 years now. And I take every opportunity I get, I try and show these happy faces. Thank you.
Thank you so much, sir, again. With that, we have a couple of questions which we have received from some of our members. I'll quickly put them across to you. So, one of the questions which we've received is that what are the essential building blocks which the health systems of all countries must prioritize in order to ensure a healthy post-COVID recovery?
You want me to take that?
So, any you or Dr. Anuj, whoever is comfortable in taking the question.
Please go ahead, Dilip. This is right, the health systems building block. So please go ahead.
Okay. Look, the traditional health systems, we talk about six core components, or as you call, building blocks. The first and foremost is service delivery. The second, of course, is health workforce that we just spoke about. Then the health information systems, essential medicines, access to essential medicines, healthcare financing, again, very important. Without money, you can't do anything. And the last but very important one is the leadership and governance. But as we have seen in these trying times, well, first of all, so essential services, essential medicines now also includes essential diagnostics as well. I mean, as we have evolved, as you say, in the changing times. And also it's about a resilient health system. Resilience is the word that's used in many parlances these days, because it's about able to face what we face today and also being in a state of readiness for what we might end up facing in the coming days, in the coming months. And one important component that is part of maybe the service delivery health workforce, you can put it anywhere, and which India recognized a couple of years back with Ayushman Bharat, is the comprehensive primary healthcare. That we think is the key to preventive and wellness measures that can be taken at the lowest level, outermost level of healthcare system, public healthcare system in India. Thank you.
Thank you so much, sir. Uh, the next question which we've received is that what are some of the key lessons that we as future healthcare providers should definitely learn from this public health emergency of international concern?
Okay, let me take that one. Dilip has given you a lot of good ideas about ensuring a technically competent health workforce and also keeping them happy and stuff. But from a post-COVID scenario, it's very essential to ensure that we focus on preparedness for future public health emergencies of international concern, future pandemics. AMR is another pandemic which is ongoing. It's a slow-moving pandemic. Also, influenza is another can turn into influenza, especially avian influenza, has the potential to become another public health emergency of international concern. So keeping all these things in mind, it's very important to have preparedness for these events. International health regulations are a legally binding instrument that all countries have signed internationally to prepare the country's systems to tackle these public health emergencies of international concern, share information in a timely manner. Unfortunately, these things do not happen seamlessly across countries. As we saw, even in China, when the outbreak started, it took them some time to report it to WHO, and WHO had immediately shared that information globally with all the 194 member states. There was a global group, which was a technical advisory group, which was overseeing the developments and advising the next steps at every step. Especially from the lessons learned also need to be kept in mind, not just preparing for these emergencies, but also preparing for surge capacity in terms of not just strengthening the system for the current needs, but also any surge that might be expected in times of pandemics. So that looks at, that means ensuring good health infrastructure, not just hospitals, but also primary healthcare facilities, so that you have systems in place. Also have good telemedicine systems in place. Surprisingly and thankfully, in India, we saw that doctors who were reluctant to use telemedicine quickly jumped on when they didn't have any other option to start practicing telemedicine. So telemedicine was a huge, I would say, sort of a lifesaver in during the pandemic, where we had the lockdown, we had restrictions on movement. So that was another area and a good learning experience for all of us. Also, another learning is that essential health services have to continue during any public health emergency of international concern. The disease control programs, especially TB, HIV, malaria, the neglected tropical diseases, a lot of them actually in the initial phase the patients faced a lot of problems in accessing health diagnostics as well as care. Also, the non-communicable diseases patients like stroke, heart disease, diabetes, etc. A lot of those patients also faced a lot of problems. So essential healthcare services have to continue during the pandemic. So these are some of the things. A lot of interaction reviews have happened, and I think in the post-COVID world, we will be looking at a lot of learnings from this pandemic going forward. But again, as young health professionals, I would urge you to stay abreast of all the news, especially being aware of the infodemic which is going on. We have a lot of misleading information also. So make sure if you're looking at health information, look at credible sites, look at international sites. You can look at WHO, CDC, ECDC. But at the national level, look at the Ministry of Health website, look at ICMR, look at NCDC, or look at the other government health departments or the state government websites, which will provide you credible health information rather than any information. So these are just some of the things that come to mind.
Thank you so much, sir. The last question which we have is in continuation of what you just mentioned about telemedicine. And the question goes that has the COVID-19 pandemic also revolutionized healthcare completely by highlighting the importance of telemedicine platforms and digital health technologies?
Yes, I will ask Dilip to come in on this as well. But I will like to share that India already has a national digital health mission. What this means is India has already prioritized digital health in a big way. India has a lot of IT sort of bandwidth in terms of the human resources that we have. And we have a technically literate force which can help not just with the hardware, but also the software development, etc., and making use of that information technically as well. We already have the National Health Information Portal, which is their IHIP, Integrated Health Information Portal, which is expected to be the government's backbone for evidence-based policy making. During the pandemic, there was another portal which was generated, S3 portal, but right now all the information from the S3 portal is now being sort of backlinked into the IHIP, so that provides much better graphical interface. And WHO India is a partner with the government, with the Ministry of Health for this initiative on monitoring the health situation. In addition, the National Health Authority is the repository for digital health in India. And they are working on Ayushman Bharat and the health and wellness centers across India using technology, using telemedicine. In addition, the National Informatics Center has also, which is under the Ministry of Science and Technology, they have been using telemedicine, especially for training and for service delivery in the hilly and hard to reach areas across the country to provide them with healthcare services. Also, some of the private setups already have outreach programs like Narayana, LV Prasad Eye Institute, Wockhardt. A number of other institutes also provide telemedicine services to reach out to patients so that patients who need care can be sort of selected and brought to the main facility, and people with minor problems can be treated where they live. So just like hand hygiene has been something which we've been pushing for a very long time, and the pandemic ensured that not just the doctors, but also the public started washing hands properly. So telemedicine is another area which has benefited from the pandemic. And I would request Dilip also to share his insights on this. Over to you, Dilip.
Thank you. Thank you, Anuj. See, Molly, telemedicine had started in India, especially with the National Rural Health Mission and then the National Health Mission. But they were done, as islands of excellence. So you had teleophthalmology, you had some teleconsultations linking district hospitals with the peripheral health centers for specialist consultations. Or one had started, some states had started teleradiology. So you do a CT scan or an X-ray, and then you forward the image to a central working station in the capital or remotely otherwise, with specialists providing the expert readings on those X-rays. But as Anuj says, and rightly so, this pandemic has revolutionized or multiplied manifold on the kind of uses of tele services. So, for example, the e-Sanjeevani, which is the government of India, this thing where you can just register, book, you get a token. So, waiting time, they say, is hardly about 7 to 8 minutes or 10 minutes. And every state has pushed for its own version of such means to take care, because essential services was really hurt when in 2020 when we were trying to cope with the first round. But as I said, it's just building on what was existing. We had for so many years telephone consultations, telehelp lines 104 and so on and so forth. Now you also have not just for essential services, but for dedicated COVID care telehelp lines as well. But private practitioners, individual private practitioners also now resort to telemedicine consultations for many of their patients who do not need physical interactions, or they don't need the doctors to hold their hands or listen to their heartbeats physically. So those cases are slowly shifting to this new platform. Thank you.
Thank you so much, sir. With that, we don't have any further questions as of now. And if there are any questions later, please feel free to reach out to us, and we'll get in touch with Dr. Anuj and Dr. Dilip and get back to you with your respective answers. With that, I would love to introduce and invite Dr. Purva Prabha Patil, who's currently working as the president of the Medical Students Association of India and is also an intern doctor at Kasturba Medical College, Manipal. Purva, over to you.
Thank you so much, Molly, and thank you so much, Dr. Anuj and Dr. Dilip, for taking the time out. We understand that we try and invite you somehow at the most busiest periods in the office, considering the pandemic as well. And the webinar in general, it hasn't even ended, but we've already started receiving quite good feedback. So thank you so much, not only for coming to this webinar, but also in helping us create ways to engage medical students and young health professionals within the work of WHO, starting right from AMR up until here. And also, thank you so much for the special mention on careers in public health and how medical students can engage. Because as an organization housing more than 20,000 medical students, we often find it a little challenging to provide opportunities that cover everybody. And we constantly receive questions on how people could engage with the country office as well. So thank you so much for taking the time out, and thank you so much again for sharing your valuable insights. I would like to invite you, considering the Q&As over and also the webinar is, for any closing messages that you may have for medical students across India. So I can hand it over to Dr. Anuj and Dr. Dilip for any closing remarks. Thank you.
Why don't you go first, Dilip?
Okay. The ball's in my court now. I wasn't expecting that, but look, friends, trust me. Actually, you don't to do public health, to do service to the poor, the vulnerable, the marginalized. I can go on and on and on with these, adjectives. But as we were on another platform, I was, laying a lot of emphasis on leaving no one behind, and Anuj was there as well. So if you really want to contribute, you don't necessarily need a public health degree. I think when I first started working in the tribal areas, I was just a plain MBBS doctor, and the difference that even an MBBS graduate can make to the life of these those residing with all the adjectives, but also residing in places which are difficult to access, and to higher levels of care, and the lives that you can save, the lives that you can make better, the potential is endless. And I started my public health career, and primarily after serving and seeing the conditions myself for a period of 3 to 4 years. So as I said, you don't need fancy degrees from big institutions or foreign institutions to really get doing work, doing stuff, or getting into work. And said, get your hands dirty, go down there, and that just might be a life-changing moment for you, and you just might start loving public health and service that you can do for the greater good of the population. You don't treat one patient or 10 patients in a single day OPD. With one intervention, you might make difference to hundreds of people every single day. Thank you.
Okay, I would like to say to all the medical students, all the members of MSAI, always do remember the basic cornerstone of medicine. First, do no harm. So to practice that, you need to ensure that you follow evidence-based medicine. Keep yourself updated. Ensure that you practice medicine which is evidence-based, and also keep the patient in mind. It's not cookbook medicine which is to be practiced. All the treatments have to be tailored for the patient, and whatever you know has to be applied to individual patients, and not just all patients get the same treatment irrespective of their thing. So individualize your treatment. And also a little bit about the opportunities in terms of, as Dilip was mentioning, you don't need only public health degrees. You can, and I can give you my example. I specialized in medical microbiology, and I was working in medical microbiology, working on surveillance, working on AMR, working on e-health, infection prevention and control. And that's how I sort of got noticed. I started publishing all our information that we had, also journal articles, other documents. So whatever you do, whatever choice you make sure you do a good job. And then you will realize there are a lot of opportunities in public health. It's not just public health doctors. We have a number of engineers, we have non-medical people, we have some scientists, basic scientists, we have a lot of PhDs. We also have a few legal people, and some of them are also, we have non-medical people who look after our administrative thing, especially the monitoring and evaluation program support, etc. So there are a huge number of opportunities. Whatever you do, make sure you do it well. So all the best and thank you.
Thank you so much. Those were some really powerful messages, and I hope a lot of what you say we will carry in our careers moving forward. Thank you so much again for joining us today. And with that, we would like to call it an end for this webinar, but hope to have continued engagement with you on future initiatives like we started this year. Thank you so much.
Thank you so much. Thank you.
Thank you. Thank you very much. Thank you.